Welcome to the village. Today as my guest host, I have with me Dr. Carrin Schottler-Thal, MD, of Albany Medical Center. She's a general pediatrician for children with autism, and she also is the medical director of the Autism Medical Home at Albany Med. And I appreciate your time so much. You're such a busy person, and you giving me this time to talk about this really important topic. I really appreciate that.
Thank you for having me. Any way to get the word out and get people help or reassurance, I'm here for you.
Yeah, that's very appreciated, not just by me, but by the whole community. I had met you at my hospital several weeks ago, and you gave us some education, so I thought it's a good idea to talk to you, and maybe we can talk some more about some of these topics for not just for the providers, but for families to know more about autism, because as we know, like we can say it's a hot topic. It's on everybody's mind, what autism really is, and everybody wants to know more about how to recognize if their child or a family member's child has autism, what to do about it. It's kind of a mix of information. It can be really confusing. But what have you kind of noticed with what's on people's minds? I mean, being the director of the medical home, like how are people kind of starting to feel differently about autism or think about it?
I think the biggest and the most exciting thing, I think, is a lot of people, and I'd like to start positive, is a lot of people are going more into autism acceptance. How can we embrace neurodiversity and really help people who have a diagnosis of autism become more a part of our community by getting jobs, making sure they feel comfortable in school, comfortable in the workplace, and making sure that they receive services in a way that they feel comfortable. So that, I think, is a big thing that I feel happy about and I think is really becoming more and more prevalent. So that's a big, exciting topic that a lot of people are talking about. I think the other thing is a lot of people are talking about what we call the rise in the prevalence of autism. The CDC recently came out with the number back in 2021 that now 1 in 36 children have the diagnosis of autism. We can talk about that a little later, but I think a lot of people are saying, well, why is this on the rise and what's the explanation? So that's a big hot topic. And I think the other hot topic is people want to know, well, what is autism and how do you make the diagnosis? Probably several years ago, we did change the diagnosis criteria, and I think a lot of people are still wondering what exactly are the criteria, what distinguishes autism from other things that used to be diagnosed, such as Asperger's disorder, PDD. And so I think those are the big hot topics that a lot of people have on their mind.
So, like you had said, acceptance, and that it doesn't necessarily have to be this big scare. You know, if somebody's child is diagnosed with autism, maybe it's just something you need to diagnose early so that they can get all the services they need to become a productive adult. But it's not necessarily a bad thing. Like previously had thought that my child is disabled, what's going to happen to them? I think people can live full lives, right?
Right, and I think autism's really been around since the beginning of time. Mm-hmm. And I tell parents that I would never want to cure autism. That would be a horrible world. Mm-hmm. Autism's responsible for many of the world's greatest things, the most beautiful pieces of art, the best pieces of architecture. So I would never want to cure autism. The human race needs autism to thrive and be productive. So we need all kinds of ways that people think. So I do think that's a good way of thinking and making sure people understand that about themselves or their children.
That's such a wonderful way to recognize it, because you're right. People who have been diagnosed with autism can do things, they do it in a certain way. If you look back on time, now we are recognizing more people who would have been diagnosed had we known more about autism. Mm-hmm. So maybe it's not on the rise. Maybe it's just being diagnosed more.
Yeah, that is a big theory, that we are diagnosing it more. Yeah. A lot of times families come in and they ask, this has never been diagnosed in my family before. And I say, well, look back in time in your family and think about some relatives. And maybe you can start thinking about the criteria, the DSM-5 criteria, and maybe you see some traits that are in some relatives that maybe there was some diagnoses in your family, and it can be an aha moment for a lot of people and families.
Very true. I think we all can do that. Then with the diagnosis, I know people come in to the office, me being a general pediatrician for like the general population can be like the first go-to, general pediatricians tend to be. So they come in with concerns and how to diagnose. And I always start with like a screening. But besides my simple screening, like how is autism usually diagnosed? How do you know if your child has autism?
Yeah, well, I think it's so important that pediatricians do early screening. And the way to really diagnose autism is to really understand the DSM-5 criteria. And I think pediatricians definitely understand the criteria, and they can definitely make a diagnosis. I always want to say, though, that the diagnosis is not the emergency here in autism. The big thing and what you need to do quickly is the minute that you suspect autism and you think that they may be eligible for services is to get the child into services. And you can talk about diagnoses later, but really you want to get the child into services right away. But to make the diagnosis, the DSM-5 criteria really are important to understand. And it's a combination of social criteria, social differences, and repetitive and restrictive play and interests differences. So I always like to go over the criteria with parents. But a good way to really talk about it with parents is to tell them that autism really is just a difference in a way that a child experiences their environment. And when you kind of talk about it that way, the criteria really make sense and they can see why that fits their child. So the first three criteria are the social criteria. The first criteria is that children with autism have difficulty with language. It may be a language delay, or maybe they have a great vocabulary, but they have difficulty in the reciprocity of language, that back and forth of speech, how to have a conversation with a person. Are they able to do a give and take of a conversation? Sometimes children with autism tend to be just talking and not having that back and forth or the reciprocal conversation. The second criteria is children with autism may have differences in the way that they interpret nonverbal communication. The classic way that we see is children with autism may have a lack of eye contact or differences in the way that they give eye contact. But that's not necessarily always true. Some children with autism may have taught themselves to have really good eye contact, but you want to look at other nonverbal cues that they may be missing. Do they go into a room that's really serious and not understand that it's a very serious time in the room? Do they not understand that maybe somebody likes them and they give them a face and they don't understand that that person likes them or dislikes them, thinks everybody doesn't like them, and they don't understand the facial expressions of people? And then the third criteria is children have difficulty with their peers. They have difficulty understanding their peers. They may do very well with adults, but their peers are a little bit unpredictable, and they don't do as well with their peers as they do with other people. And that makes sense if you have a child who's interacting with their environment differently. If somebody's unpredictable, you want to go to the adults who may be more predictable to you.
That makes sense.
Yeah. And then the restrictive and repetitive factors are also part of the diagnoses. And you need at least 2 of the 4 of these criteria. The social criteria, I always like to emphasize, you need all 3 to make the diagnosis.
Okay.
But the restrictive, repetitive, just 2 of the 4. And the first one being is, do they have any kind of repetitive type motions in their life or repetitive type things that they do? That is usually characteristically seen in toddlers, like flapping of the hands. They sometimes can rock back and forth. These can sometimes be things that calm them down. Sometimes they'll do repetitive phrases over and over again, or they may repeat exactly what you say to them. Let's say I say, "Dr. Majid, how are you doing?" And you responded with the exact same words. "Dr. Majid, how are you doing?" Is something called echolalia. They may demonstrate some of those things. The second criteria is that children with autism may have these very special interests. They may know everything that there is to know about Thomas the Train. They may know everything there is to know about the Beatles. My son has autism and he knows everything there is to know about Elvis Presley. They have all these really, really fine interests, and that's where it gets really fun. That's where we develop these really really interesting skills. The third criteria is that children with autism have some sensory issues. They may hear, they may see, they may feel, they may smell things differently. They may be averse to these things, or they may seek some of these things out. And then the fourth criteria is that people with autism like to have their routines done the same way every day. They like to see things done the same every day. They may have their diet. They want to have chicken nuggets from McDonald's every single day. You get a restricted diet because they understand that. They know their routine. It's predictable. It's something that they'll know will be the same every day. And all of these things make sense if you just think of what I tell parents is that they just interact with their environment differently. It's kind of like going to Mars. If I took you to Mars one day and you were there, you would want anything there is that would remind you of Earth there with you to make you feel a little bit better.
Yeah.
Yeah.
Some of the things that you mentioned, like parents will bring up because they heard about it, like hand flapping comes up a lot. They say when their child is excited, their 2 or 3-year-old, they'll flap their hands. But when I hear about that, I just want to know more about other things because I think a lot of children will flap their hands out of excitement. But does that point out more of, okay, well, if you flap your hands, it's more likely that you have autism? Or do you think a lot of kids flap their hands?
Oh, yeah. And I think what you said at the beginning is that you want to find out more about it.
Yeah.
And I think I would pursue those other criteria because it's just one of the DSM-5 criteria. You need all those other criteria that I mentioned to really make a diagnosis.
Exactly. And it's more detailed. But I think, like you had said, that it's one, if something comes up, and I think this is something really good for parents to know, that they have the right to bring up these questions. They may have heard something or have another family or friend who has a child with autism, and they may see something that comes to their mind.
Yeah, and I think it's good to keep those gates open so that they do tell you these things and get the good information from them that you need to make accurate diagnoses and give them good treatment.
You had mentioned, like, of course, when we see any kind of delays in development, we want to get those services. And I always go to the county for early intervention services if they're younger than 3. And then after 3, they'll have to go to the school district. Besides those kind of like therapy services, what else can parents advocate for? Because not everything is obvious or available. So what should we be pushing for kids to be serviced with?
I think that's a really interesting statement because there's so many other services out there. I think the first thing you want to do is you want to make sure that the parent is well taken care of. A lot of these diagnoses, and when children get these diagnoses, it can be very emotional for the parent. Yeah. It can really be stressful for the parent. So I think a good thing to make sure the parent is healthy. If you don't have the parent healthy and the family strong, the child's not going to be healthy and strong. So I think a good service to make sure is that the parent is getting good mental health services and the parent is getting good medical care. So I always want to push for those things and make sure that parent has a good primary care doctor and they're feeling healthy. There are other services out there. Sometimes parents choose, if they're not getting speech therapy through the school district, if they did not qualify, they sometimes will get private speech therapy through their insurance. And then there's a lot of other different types of therapies out there that the school doesn't necessarily provide in the school setting. There's all kinds of fun therapies that sometimes people get, things like equine therapy, horse therapy. Mm-hmm. There's mental health therapy. A lot of families will opt that their children get talk therapy. And these are great therapies that sometimes are provided in schools, but sometimes parents prefer to get them done privately. It's so important. Sometimes therapy is important for children to start learning, how do I express myself emotionally? How do I understand what it feels like inside when I start feeling sad and angry? And how do I express that emotionally? Because somebody with autism really struggles with what I call building an emotional vocabulary and really feeling those things and understanding what those things feel. And then there's all kinds of other different types of therapies out there. Art therapy.
Just thinking that music
therapy. And these are not necessarily always provided by the school, but a lot of parents will choose to find them in their communities. And they're really great ways to get, first of all, the child out in the community. And second of all, they're very fun, and they're great ways to really start having the child develop other interests and start using other sensory experiences in their life.
Yeah, I had a mother whose child was autistic, and she was also very hyper. She had a lot of energy, so she put her into tumbling. So she said she just got her energy out, and
those are great. I think it's great getting the child out there, and it's a great way to build peer relationships. Yeah, it's a great way to make sure that they're just getting out and experiencing life.
Right, exactly. And everybody has the right to experience life, and the more you do, the less for any of us is like built in. Mm-hmm. You have this urge to do or do things to the best of your ability. And everybody has the right to do that, and we all want that for children.
Yeah.
Right? Yeah. And that brings me to, and this is kind of like the whole point of this podcast, is welcome to the village, because the village, everybody is responsible and involved, right? So if somebody's child has autism, that is a lot of stress for that one person. I think we all have a responsibility to deal with each other and to help. If somebody has autism, how are we all kind of responsible for each other's well-being? So that is like the school is involved, the doctors, the therapists, the parents' family. So it's good to be supportive, and so it's good for everybody to be aware. Are there resources that you know of, kind of learn about autism and how they impact things?
Yeah, one of the best resources I think out there in our community, the Capital Region, I think is the Autism Society of the Greater Hudson Valley, or it used to be called the Autism Society of the Greater Capital Region. That is a wonderful society that provides so much information and education, and is a great advocacy group for people with autism. And I think that's a great way to get information. Right. Yeah. So I definitely refer people to that group. And I definitely tell parents to bring in family members to the visit with me. And I would hope that pediatricians would tell their families to do the same. Yeah. It's a great way to educate people and make sure they understand what autism is.
Yeah, definitely. One thing I did want to mention too, people do want to know how autism happens. Are there risk factors? Is it genetic? Is there something that happens? And I think we call it risk factors in that if it's considered a disability, people are wondering if there's a way to avoid it, because people do get stressed out trying to figure out how best to bring a good life experience for their child. It's a little bit different when your child has autism because of the needs that we are still learning that they require. So are there risk factors?
Mm-hmm. And I always like to start the risk factor with vaccines do not cause autism. Right. I have a wonderful story about this issue, in that I have a patient of mine who has a teenage daughter with autism, and had a younger child born with autism, and the younger child had a different father than the older child. And that father was talking to the mother, and before the younger child was vaccinated, and said, "I don't want her vaccinated because I'm afraid of autism." Mm-hmm. And the mother told him, "No, she's going to get vaccinated." She goes, "And if she gets autism, she's going to be just as wonderful as my older child."
Exactly.
And I thought, well, vaccines don't cause it, number one, but what a wonderful show of love. And I always tell people that I would never ever want my child to get polio and diphtheria and all these other terrible things, and God forbid they get that, and I wouldn't want that to happen to them. Those are killers.
And you're so right. I've heard that before too. I have parents who come to our office, and they used to work with me, they're respiratory therapists, and the older child is about 5 now, and she was asked the same thing by a friend, like, she has autism, did you get her vaccinated? And she said, yes, I did. And if first of all, it didn't cause it, but I don't think it's a bad thing. she has autism, and if it's because of vaccines, well, I know she's not going to get polio.
Yeah, thank God,
she's
right?
wonderful that and part of who she is she has autism, and she's wonderful.
And that's what most parents will say. I just love my son or daughter the way they are. They're wonderful. And so I always like to refer back to that. But no, vaccines do not cause autism, and that's definitely been proven over and over again.
Yes,
but there are
a lot of proof.
Yes, there's a lot of proof. But there are some people think that there is some other risk factors. There is a genetic component to autism. We definitely know that about 20% of people with autism may have a genetic difference. So that's one of the things. There is some studies, and these studies are still not proven. They're still looking at this in that paternal age. The older a father is, there may be an increase in the incidence of autism, but that's still the research is still a little iffy on that. And then the other reason, I think, is that there's more and more awareness and diagnoses and different diagnoses. I read an article the other day that there used to be a lot of diagnoses of what they used to call mental retardation or intellectual disability. And those patients back in the 60s were, a lot of them were institutionalized. And people thought, well, there's nothing that you can do to teach or to help these patients. And the deinstitutionalization of a lot of these patients, and with new therapies and the ability to teach and help a lot of these patients that probably would have been labeled as intellectually disabled back in the olden days are now we're really showing there's autism here, and that, there's a lot to do about it.
Yeah.
Now that we have, assistive technology and we're able to get into the minds of a lot of these patients, they have a lot to say. We know.
Yeah.
Well, back in the 60s, we didn't know how to teach people with autism.
Yeah.
So I think that a lot of the patients were, not diagnosed with the right thing back then, and we didn't know how to teach them. We didn't know what therapies to give. So I think there was a lot of different diagnoses and misdiagnoses, and now we really know how to give them a voice and know how much they know.
We have such great strides in medicine in dealing with each other.
Yeah.
And just helping humankind just have the best lives possible.
Yeah.
It's pretty great.
Yeah. And assistive technology has just been wonderful, having people who may not have had that voice have that voice and really understand they have so much inside.
Tell me more about that. You had mentioned that when you gave us our talk.
Mm-hmm. It's great. Study after study have shown, a lot of parents ask, if I give my child assistive technology, is that going to take over their speech and they're never going to speak because it's so easy to use a computer? And that's wrong. Actually, assistive technology just really helps augment speech and helps them speak even more. It just gives the brain that extra prompt to really help develop those pathways of speech. So most children with assistive technology, their actual speech will increase it. So I think it's so important to use assistive technology once a child is able to. So that's really important to start. And a lot of adults who are autistic say that their frustration level and their mood got so much better after assistive technology was introduced to them. So it really has a behavioral effect as well. If you can imagine how frustrating it must have been without the ability to speak or communicate. So that's another great way that we are now helping our patients with autism.
That is so great.
Yeah.
It is true. You think about how frustrating it is if you're not able to voice what you have to say.
Yeah.
For any reason. That's pretty frustrating.
We're seeing in the news people who use assistive technology and who were considered non-verbal graduating college and using these skills. So it's really wonderful to see people really living up to their fullest potential.
And I think that's the great thing is we have like this autism awareness. It's awareness so that we know and understand better.
Mm-hmm.
So that we don't have these misconceptions that just make things harder. Like when you know the wrong information, it's worse than not knowing anything.
Yeah, you're absolutely right.
Palliative care appropriate? I'm learning more about palliative care. My sister does palliative care. Palliative care is for anybody with any kind of chronic disorder or difficulty, and parents need resources and help like navigating systems.
Yeah, it's interesting because I always think of palliative care as being end-of-life care.
But I think that's what we like I used to think too, and then learning about it, it's actually chronic disabilities too.
Yeah, without using that term palliative care, I guess the care that is out there is really, I think that New York State does a very good job, and other states try to do these things. The care that is out there, especially for patients with autism whose functional ability is low to the point that they may need some help with activities of daily living. The help that is out there is through the Office for People with Developmental Disabilities, and they help a lot with a lot of the chronic care management of autism. And what OPWDD does is a lot of help, like with respite care for families, if a family may need some help with babysitting and or taking care of their loved one with autism so that they may need a break. Yeah, so that's a really helpful source. And then OPWDD then goes along as the child ages with time to help them with work help. So they may have somebody, a work helper, somebody help them with their job, help them with housing later on in life, help them with typical things like that. So from a chronic care management, that is a lot of what's available from the state and from things like that.
Which is important, just navigating the system and figuring out what resources are out there.
Yeah, and that I find is a little difficult for parents still, and even myself as a parent, I found it very difficult. I wish that were a little bit more user-friendly.
Yeah.
So I think as, we progress, I hope that becomes a little bit more, it becomes easier for this population.
Definitely, and I think it's important to surround yourself with good support since it's so difficult.
Yeah.
And, I always say too, like part of your circle, like good, you can't really help the teachers and school system, but like the doctors that you have, the therapists that you have, that the pediatrician, it's hard for us to navigate. We don't know everything that's out there either, but a willingness to try to figure it out, try to talk to someone, just figure out together even what's out there.
And then speaking of care, medical care, what I think pediatricians should do is really setting up people with autism for a longer life expectancy. Studies have shown that people with autism have a shorter life expectancy, 10 years shorter than the average, a typical person. And then if you have intellectual ability along with autism, it's an even lower life expectancy in your 40s, which is not good enough for us, I think. I think we need to do better. The major causes of morbidity and mortality in people with autism is, number one is accidents, drowning being a big accident. Number two, cardiovascular disease, seizures, and then depression, suicide. So I think as pediatricians, in terms of chronic disease, we really need to do better to control those diseases and those chronic diseases to help our patients have just the same life expectancy as everybody else.
There's the comorbid conditions, and then there's the features of autism that make it difficult. So like the comorbid conditions or maybe some other genetic disorder, like having a seizure disorder.
Yeah.
But then, like you said, if the cardiovascular, there's difficulty with sensory issues, so wanting to eat certain things, lifestyle things. Definitely the accidents. The wandering is a big issue with a lot of parents have had a lot of stress and concerns with the wandering.
Yeah.
I've seen that one of my patients, he's 20 now, or 21. The parents, the family were leaving for Florida on vacation, and he just bolted from the airport because he just didn't want to be there.
Yeah.
So or I don't know, I can't say he just didn't want to be there. He said to me later he just didn't want to be there, but what he was feeling at that moment, it was difficult. There's many reasons, I think, for the wandering, but many children and many people with autism tend to do that. And I think on the younger age, there's more things the families can do now, right? If they're worried about their child wandering. Yeah,
that's a very good question, and I always want to get the word out. The first thing I always tell parents is a lot of times with wandering, children with autism are really attracted to bodies of water. So the first thing I tell parents, as soon as they can, get them into swim lessons. So that's important. And then children, especially in New York State, I'm not sure if they have these in other states, we have Project Lifesaver where you can call your county sheriff's department and get like a little GPS bracelet to have around your ankle or your wrist. And the sheriff's department comes and changes that battery every 3 months or so. So if a child does wander, we can find them.
Yeah.
Those are great. So I think those are great ways to kind of help find people if they do wander. I have a service dog that I have for my son. If he wanders and she's a tracker, she can track him down. So there's things like that out there to help families too. So there's a lot of different things, but I think that's a really important thing to talk about in your anticipatory guidance when you're a pediatrician. It's not necessarily something we talk about in typical visits, but it's something definitely in a child with autism you need to address.
Parents are very stressed out when they have children. Yeah. And then when you add to that a child that you're not sure yet how to communicate with them best, or they don't know how to communicate with you, that's a tough thing. So whatever help they can get.
I had a great tip, and maybe this is a great place to get this out because if a lot of people will hear it. I got this from a autism swim instruction teacher, is that teach your child to do a routine, loud type song and dance before they get into any body of water. And children with autism love to do things routinely. And this way, if they ever get into a body of water, you'll be able to hear them get into the body of water.
Yeah.
This way, if they do some sort of, ring around the rosy, whenever you hear them say ring around the rosy, you know they're going to a body of water. So that's a really great tip that I learned. And I love to get the word out because I thought that was a really great safety tip.
That's true. Once they learn that, they won't not do it.
Yeah, and then they'll say that out loud, and you'll know, oh, they're saying that. I gotta go get them.
Yeah, I think one mom too. She was able to get a fence built, or she wanted to. And some of these things can be paid for if your child has a diagnosis. It can be tough sometimes, but I think just finding out and advocating for all the services possible.
Yeah.
Yeah.
OPWDD sometimes can give you, if you do get approved, they sometimes can help you with funding, things like that.
Okay. They're a good resource to know what's all available, because not everybody can afford things.
Yeah.
Schools don't have a lot of the resources that they need. I know there's some specialized schools for children with any kind of disability. Regular schools that children are in, they don't have an intellectual disability. It's hard then to qualify for other things they need. They may be very intelligent and do well, but then how do we get the teachers and the board to understand that the child needs something else?
Yeah, that can be tricky, especially if a child's doing well academically. You definitely want to advocate for the child to be in the least restrictive environment. And that means you want to make sure that they're in an environment where they are at their fullest potential. So if they can be integrated, you want them integrated. And you don't want to use autism as any kind of reason to do an IEP. You want to use their skills. Okay. So if they're able to do, AP calculus, you want them in AP calculus. So the school will generally just give services if anything is being affected at school. So if you are fine and doing well in school, not causing any trouble, and at home you're having all your trouble, school will generally not give you services for that. It kind of makes sense. But you really want to make sure that your child is feeling well at school. They're not giving you a tough time going into school because they're so stressed. They're masking all day and they can't achieve things without really getting anxious. So you really want to make sure that that's being taken care of at school too. Some of those things may just require not an IEP or something called a 504 plan. So an IEP is used if you need to change the actual curriculum that a child's learning. You need to change what they're learning. A 504 plan is just maybe you need to change the environment in which the child's learning, where they're learning. So let's say a child's able to complete all the work just like a typical patient, but you need to change something in the environment to make it easier for them. So they may maybe just need a 504 plan. Maybe they need to take tests in the library rather than in a crowded classroom because it makes them feel more comfortable. Maybe they can't go into a lunchroom because it's just so loud and they eat lunch in the library and that's better for them. Yeah. So a 504 plan may be something that the parent may request rather than an IEP. So those are great ways to kind of help parents. You can kind of learn the lingo and learn what schools may be able to do for your child. And then you may think, okay, well, they're doing well in school, but at home, maybe we can start thinking, well, maybe they need therapy at home. Maybe we get them a private therapist to really help them with their stress or their anxiety. So you kind of want to see where the problem is happening and which resources you can use.
That may be fine-tuned for that child, and the parent sometimes knows best what that child would need. Sometimes the teacher, which brings me to think it's a good idea for the teachers and the pediatrician to kind of be connected.
You're absolutely right. What I worry about a lot, though, in the children who are doing very well academically and coast through school, and I always mention this to parents and I think it's good for pediatricians to know, is a lot of the children who may be not integrated and who have IEPs, they may be learning a lot of life skills such as cooking, riding a bus, all these things that schools do so well. But the kids who aren't in those classes and just floating along with the typical peers, they may not be learning those skills. And as we know, somebody with autism may really have trouble with those skills. Yeah. And if school's not addressing it, I tell parents, this is really something you've got to work on. Yeah. Because when they go off to college, because they are a great mathematician, you want to make sure they're not going to be in a dorm room, not able to care for themselves. Yeah. So it's really important with those kids who are doing very well academically that you stress to parents that they really need to learn those life skills.
Yeah, that's true. There's so many things to learn in life besides academics.
Yeah.
When you mention the term with anxiety, that brings me to these comorbid, again, going back to that, but a lot of the kids who have been diagnosed with autism, they end up struggling with things like attention, focus, and anxiety. Like ADHD, is that just kind of happens to be part of autism features sometimes, or is it just for other reasons, or does it happen to be they just happen to have both?
Yeah, it's a good question. It's something it can be difficult to tease out. ADHD and autism are what we call very much comorbid conditions that they frequently go together. You have both of them at the same time. But again, if you have anxiety, as we all know, if somebody doesn't pay attention in class, it could be a huge differential diagnosis. Yeah. ADHD is one of them. Anxiety is one of them. So you really need to tease a lot of that out, and that can be pretty tricky as a pediatrician. Yeah. And sometimes you really have to get a lot of information, and that involves going to the school. That involves really learning about all of their, all about their life. There is something that I sometimes use in schools to help me kind of understand the child's behavior a little better. Let's say they're having trouble paying attention or they're getting aggressive at school and nobody really knows why. One of the things that I request sometimes from schools is to do a functional behavioral assessment. And that requires a psychologist to go in school and really observe the child and see what exactly is starting all these things. What makes them not pay attention? What's we call the antecedent? What's the thing that makes this all happen? And sometimes it could be something that you and I maybe don't find problem with at all. Maybe it's just the sound of the lights or the light, and it could be something just very, very little. And if the psychologist sees that's what's causing this problem, we could come up with a behavioral plan to really help eliminate that in their day, and it makes a huge difference. And that sometimes helps me really figure out, is this anxiety, is it ADHD, or is it a sensory thing that we can just help with? So those things really help me tease things out.
Yeah, absolutely. Sometimes it just takes someone to notice something, and then a conversation, and takes time, but
yeah, and that's a big thing I tell my parents is, nothing is ever going to be done in a day. Yeah, we really need time, and we have time. We have time to take it easy and figure this out right, and that I think is a big issue that a lot of people have. Everybody wants things done quickly, but to do it right, we just got to take our time with our patients and really understand them.
Medicine is becoming challenging. People want things quickly. Having a good communication, telling the parents that, there's work being done in the background. Even when you're not physically here, we're still going to be doing it.
Yeah. It's a lot of communication and time.
Is there any message that you'd want to give people just society about autism or anything that you think that we didn't talk about that they should know?
Yeah, I think we still need to work a lot on adults with autism, making sure there's good job opportunities, making sure that they experience a good adulthood. I think we do really well in helping children with autism. We're really getting really good at it. And I think that there's more things to come, but I really want to get our adult physicians on board with this.
Yeah.
You know, I really want to make sure that we're exploring autism in the geriatric population.
Yeah.
We're exploring autism in the adult population. We're making sure they're getting into our workplaces. So I think that's what I think we need to do. And I'd like to get that out there so our other colleagues are really getting on board. This is a wonderful population, great people, great families, and so happy doing this work. And I hope I get my other colleagues on board to do it too.
It's so wonderful to have someone like you here. I've started to send a lot of kids your way to have like this communication so we can just keep learning and keep helping everybody. And you're right, it needs to continue. We need to maybe do some backtracking of adults that maybe weren't diagnosed, things like that, and how to continue forward. But hopefully it'll trickle over to the adult side.
Yeah, I hope so.
Yeah. There's hope and there's good community support and we can do our part.
Yeah, this has been fun. Thanks.
Yeah, thank you so much.
Yeah.